A recent study estimates that during a 6-month period, children with autism spectrum disorders receive an average of 6 different types of intervention or treatments from 4 different agencies and 7 different professionals. Although this multidisciplinary approach is often needed for effective care, it can be confusing. After all, these various professionals work in different places, have different roles, and use different terminology. So how can this gap be bridged so that individuals with ASDs get the interventions or treatment that can make a real difference in their lives? Professionals and parents worked together to address this issue in a new free publication, Autism Spectrum Disorders: Guide to Evidence-Based Interventions. First, it's important to learn more about how healthcare and school systems help children with autism spectrum disorders.
Parents and professionals can limit the gaps in communication by understanding the various differences of the delivery systems, including funding, legal requirements, and those sorts of things.
Chapter 2 of the guide clarifies these differences through a detailed overview of the intervention processes across the educational, medical, and service provider systems.
When it comes to communication and parents and professionals working together, many times there are abbreviations in the particular system or vernacular of the profession that people use. In education, we use acronyms like IEP, Individual Education Plan, IDEA, Individual Disabilities Education Act, FAPE, Free Appropriate Public Education, those kinds of things.
Professionals and parents can help by learning how this terminology is used by each system.
When making a determination about whether a child is eligible to receive services under the IDEA, educational professionals may use a medical diagnosis as one source of information. However, it's important to note that in most cases, a medical diagnosis of an ASD alone is not sufficient to make a determination of eligibility under IDEA, which requires in part that adverse educational impact be established.
In addition to learning about differences in the educational and healthcare systems, professionals and parents also need to be able to share important information throughout the intervention process. The first step is to talk together about confidentiality and the ways confidential information can be shared.
One important way is for parents to sign a release of information form, authorizing each of the professionals working with the child to share relevant information with all other professionals working with that child. This allows teachers to share information with medical professionals and other service providers about how the child is doing in school and what interventions have proven to be successful when working with the child. Similarly, healthcare professionals, such as physicians and therapists, can communicate with teachers about a child's medical conditions that may impact school performance and what interventions are currently being used with the child.
Another way for professionals and parents to get on the same page is for them to communicate regularly with each other. Parents play a key role in this.
One very helpful idea is just to create a one-page information sheet about their child that would cover things like the types of therapies they're receiving, what their strengths or interests might be, and can help give the teachers a starting point for beginning to learn about that child. I think the most important thing for parents and professionals is to choose a method of communication that best fits their particular situation. So some parents and professionals find email a very efficient way to communicate. For others, a good old-fashioned pencil and paper communication notebook may be most effective, or a regularly scheduled phone call. Another point that is key is designating a contact person in each of those settings.
The Guide to Evidence-Based Interventions is designed to help clinicians, educators, families, and service providers work together to make the best decisions about intervention options for individuals with ASDs. It summarizes 6 systematic research reviews and presents evidence-based practice as a framework for that decision-making. The Guide's companion publication provides information about current best practice in screening, diagnostic, and assessment services for individuals with ASDs. These publications and other instructional videos are free and can be found online at autismguidelines.dmh.mo.gov.